Hey everyone, my name is Ryan, and for my community agency project, I looked into the organization Safe Harbor, where I made this nifty pamphlet. So, what is Safe Harbor? Safe Harbor is a non-profit domestic abuse treatment center that provides services to victims and survivors of domestic violence, sexual violence, and human trafficking. And they do so through a number of different ways. They offer adult counseling and also children counseling, where they employ trauma informed approaches to deliver evidence based and best practice interventions to help children and adults increase their coping strategies, decrease their sense of isolation, come up with safety plans, and also build resiliency and promote healing. The and they also offer these counseling sessions bilingually, both English and Spanish, and also in a group or individualized setting, whatever's most comfortable for the survivor. Also, these counseling sessions can be seen as primary or secondary prevention strategies, as the therapy can help identify mental instabilities or help facilitate emotions in a healthy way before they truly manifest themselves into the potential mental disorders. All other services can be categorized as tertiary prevention strategies. They have court advocacy programs. They also have hospital accompanants that serve as patient advocates for when they're seeking medical help. And also, most importantly, they offer safe houses, because a lot of times these survivors are either met with the choice of returning back to their abuser or becoming homeless. So, in order to combat this, Safe Harbor offers transitional housing for these survivors, so they aren't having to make that choice. For health risks, we actually can look towards the World Health Organization. Survivors of domestic violence can be met with immediate health risks that include acute physical injuries and also more serious physical injuries that can lead to disabilities. This population is also put at higher risk for chronic health problems such as pain, memory loss, and ambulatory problems, which can affect them carrying out their daily activities. And also, studies have found that women with a history of abuse are more likely to report a range of chronic health problems such as headaches, pelvic pain, back pain, abdominal pain, GI, IBS, cardiovascular diseases. But the main focus of Safe Harbor is definitely on mental and behavioral health, and this population is at risk for mental disorders such as depression, sleeping and eating disorders, stress and anxiety disorders such as PTSD, self harm, femicide, poor self esteem, and also behavioral health problems that can include alcohol and substance abuse. They also are found to have lower rates of contraceptive and condom use and a higher rate of multiple sexual partners that can result in the increased risk of STIs, unintended unwanted pregnancies, and can also increase risk of miscarriage and abortion, unsafe abortions. So, in light of COVID-19, the World Health Organization has also published information regarding the effects of social distancing and isolation can have against this population, and violence against women. So, in order to help adapt to that environment, Safe Harbor has been switching to their counseling over to phone or HIPAA compliant video conferencing tools. And also for their safe houses, they've been instead putting women into or victims into hotel rooms to also comply with social distancing. So you can reach Safe Harbor through their business line, a 24-hour helpline, and also a crisis text line. You can text hello if it is unsafe for you to talk on the phone at the moment. And so, what would a patient look like that could benefit from this organization? We have Maria. So Maria is a Spanish-speaking Hispanic 25-year-old female who's presenting to the ED with shortness of breath, signs and symptoms of hypovolemia, and related to dehydration. And upon assessment, the RN found multiple stage bruisings located on Maria's eye, around her eye, and also on her left and right legs. Maria had explained to the hospital's interpreter that she had recently ran away from her husband, who she immigrated to the U.S. to live with. Maria is a poor historian, so she's not supplying a very accurate past medical history, and she's also not able to supply a place of residency or emergency contacts. So if we were ever to experience this kind of patient in our practice, Safe Harbor would be an excellent resource for her, and we should get her contact information aside from obviously getting proper authorities involved with this case. But Maria could benefit obviously by counseling, as she's experienced trauma that I'm sure through suppression or anything that it could really benefit her. Court advocacy, because she did immigrate here. I'm not sure if there's any requirements for green cards or just marriages. Not a lawyer. Safe houses, she absolutely needs somewhere to stay. It seems like she doesn't have any other options other than either returning home or becoming homeless. And also, Maria in this situation really could have benefited from having a hospital accompaniment to help advocate for her, maybe help bridge some of the communication gaps that she'd experienced in the ED. So hopefully we never do have to experience this, but when we do, Safe Harbor is definitely an excellent resource for these patients. But that's all I got. Thanks.